Apple jelly nodules is the cutaneous manifestation of a disease that India has been battling for long. And what is that? That is tuberculosis. Okay, tuberculosis is associated with apple jelly nodules. Apple jelly nodules is the cutaneous manifestation of tuberculosis seen on the nose. Okay, and what is this known as? It is called lupus vulgaris. Lupus vulgaris is the cutaneous manifestation of TB. Okay, cutaneous TB is called lupus vulgaris, and its manifestation in the nose, it is called as apple jelly nodules. Okay, apple jelly nodules in nose. So the question will be asked, where are the apple jelly nodules in nose seen? And the answer is lupus vulgaris. So whenever the term lupus vulgaris comes, you have to associate it with tuberculosis. Okay, and don't get confused. The lupus vulgaris is not the same as lupus pernio. Okay, lupus pernio is another different condition. What is this lupus pernio? You can see a violaceous patch on the nose and over the skin of the cheek, right? So this is what is called as lupus pernio. Okay, so where will you see this lupus pernio? This violaceous patch, it is seen associated with sarcoidosis, which is another granulomatous condition, but here you have non-caseating granuloma instead of the caseating granuloma, which is seen associated with tuberculosis. You have the non-caseating granuloma in case of sarcoidosis. Okay, so sarcoidosis manifests as lupus pernio. Okay, lupus pernio in the nose. Okay, whereas TB manifests as, TB's manifestation is that of the cutaneous TB, which is also known as lupus vulgaris, and its manifestation is as apple jelly nodules. So both are different. Okay, the lupus pernio is not the same as lupus vulgaris. Okay, don't forget that. And so you have the violaceous patch here, and apart from that there is strawberry appearance of nasal mucosa. Okay, this is skin involvement in case of sarcoidosis. Okay, the skin involvement in the skin of the cheek as well as skin of the nose is getting involved as a violaceous patch, and that is what is meant by lupus pernio. Okay, whereas in the nasal mucosa there will be strawberry appearance. Okay, strawberry appearance will be seen in nasal mucosa. Okay, in nasal mucosa it will be strawberry appearance that is seen. Okay, and so when the question is how strawberry appearance of nasal mucosa is seen in, the answer should be sarcoidosis. Okay, don't forget that. The answer is sarcoidosis. Okay, now you have seen strawberry appearance of nasal mucosa and also the strawberry appearance of the polypoidal mass, which is associated with rhinosporidiosis, right? And there is another strawberry in ENT, and what is that? It is the gingival hyperplasia, and that is also associated with strawberry gums. Okay, strawberry gums. This gingival hyperplasia causing strawberry gums is associated with, yes, it is associated with Wegener's granulomatosis. Okay, nowadays that terminology is no longer used. Okay, now what are the manifestations of Wegener's granulomatosis? It can present with upper respiratory tract infection. Manifestations will be present. Okay, there will be upper respiratory involvement in the form of the granuloma in the nasal cavity will be present, and just like in case of the atrophic rhinitis, the manifestations of atrophic rhinitis like the crusting will be present, nasal obstruction will be present. Okay, crusting, nasal obstruction, all these will be present in case of the other one, the sarcoidosis also. Okay, the crusting, nasal obstruction, all these things you can write there as well, and even a blood tinged nasal discharge, because whenever there is crusting in the nasal cavity, what happens is that the patient will try to remove that, and because of that, since the nasal mucosa is a fragile area, there will be instant epistaxis occurring. Okay, so first of all you have the upper respiratory involvement, and that is seen in case of 80% of the cases, and then you have the lower respiratory tract involvement, and this can be detected only with the help of HRCT. Okay, HRCT will have to be taken. Okay, in the chest X-ray also some features will be seen, but HRCT is definitive. And along with that, there will be involvement of kidney. Okay, kidney involvement can result in rapidly progressive glomerulonephropathy. Okay, rapidly progressive glomerulonephritis will be present, along with edema, hypertension. All these can happen. Okay, so the major three things that are involved are the kidney, the lungs, and because of the lung involvement there can be hemoptysis. Okay, the patient may spit out blood. Okay, hemoptysis, and involvement of the nasal cavity resulting in epistaxis and nasal obstruction. Okay, so these are the various manifestations of Wegener's granulomatosis. Wegener's granulomatosis. Okay, this used to be the old name of the newly detected terminology is another one. What is that? It is called granulomatosis with polyangiitis. Okay, granulomatosis with polyangiitis is the newer terminology. Okay, so when you are asked about granulomatosis with polyangiitis, don't get confused. Okay, what is being talked about is about the Wegener's granulomatosis. Okay, now what are the other features? When you do C anga, it will be elevated. Okay, and on biopsy of granuloma, what will be seen? There will be necrotizing vasculitis present. Okay, necrotizing vasculitis will be present. And what is the treatment of Wegener's granulomatosis? Treatment involves cyclophosphamide and steroids. Okay, steroids, and the patient will be presenting with features of nasal involvement. Okay, I told you there will be crusting, epistaxis, and apart from all that, there will be septal perforation. When I took you the class on septum, what did I tell you? There are two conditions which is associated with involvement of both bony and cartilaginous septum. What are they? One is syphilis, and the other is the Wegener's granulomatosis. Okay, Wegener's granulomatosis and syphilis are the two conditions which are associated with involvement of both bony and cartilaginous septum. Okay, so septal perforation also can occur associated with this condition. Okay, septal perforation can also occur. Now another devastating condition that is associated with granuloma formation is called the cutaneous T-cell lymphoma. Okay, cutaneous T-cell lymphoma. It used to have another name earlier. Okay, it was also called as midline lethal granuloma. Okay, it is actually a T-cell lymphoma, but it can have localized manifestation in the nasal cavity, which is seen as spreading to the oral cavity, gums, the palate. All these can get involved. Okay, and with that there will be extensive destruction of all these areas. Okay, so this is what is known as midline lethal granuloma or the T-cell lymphoma. And how will you treat this condition? For localized disease, you have to give radiotherapy, and when it has spread, you will have to give chemotherapy along with radiotherapy. Okay, when it is having systemic involvement, there should be a chemotherapy given as well. Okay, so these are the various granulomatous conditions of nose that you have to know about. Now, what can happen when all these granulomatous conditions occur? It can result in atrophy of the nasal cavity, the nasal mucosa, the turbinates. Okay, and what is the result of all that? Yes, it can result in atrophic rhinitis. So the next important topic that you have to learn today is atrophic rhinitis. Okay, how will you remember the etiology of atrophic rhinitis? It can be remembered as hernia. Okay, hernia. So H stands for hereditary, E for endocrine, R for racial, N for nutritional deficiency, I for infection, and A for autoimmune. Okay, so it could be due to hereditary causes, it could be due to endocrine causes like estrogen deficiency, okay, or it could be due to racial factors like it is more in whites compared to other races, okay, and nutritional, it is due to the deficiency of iron, vitamin D, vitamin A. Such deficiency can cause primary atrophic rhinitis. Infection with Klebsiella ocna is postulated to cause primary atrophic rhinitis, and yes, autoimmune etiology has been postulated as well. So you have the primary and secondary atrophic rhinitis, and among the primary atrophic rhinitis you have the code that is the hernia, and secondary atrophic rhinitis, it is due to some surgery in the nose. Okay, if you are doing a mutilating surgery in the nose, when you are trying to remove all the turbinates, for example when there is a mucormycosis, you will be trying to remove the whole of the turbinates which are involved and the nasal mucosa that is involved with necrotic eschar, right? When you are removing the whole thing, what happens is that there will be crusting in that area, it will be a roomy nasal cavity, and there will be a secondary atrophic rhinitis occurring. Okay, apart from that, it can occur secondary to all these conditions, the granulomatous conditions that we talked about, except for rhinosporidiosis. All the granulomatous conditions can result in atrophic rhinitis, that is rhinoscleroma, syphilis, sarcoidosis, Wegener's granulomatosis, or granulomatosis with polyangiitis. This is a recent terminology, right? Yes, all these conditions can result in atrophic rhinitis. Okay, so granulomatous diseases. Okay, granulomatous diseases. So how will it present? The patient will be having full of nasal crusting and nasal obstruction. Okay, nasal obstruction, but in spite of all that, it will be a roomy nasal cavity within. Okay, roomy nasal cavity within. And what is the etiology of primary atrophic rhinitis? I told you it is hernia, hereditary, endocrine. Endocrine, it is due to estrogen deficiency. I am writing down only the important ones. Estrogen deficiency. Racial factors, it is due to the due to it being more in whites than other races. That is what you have to remember. And nutritional deficiency due to iron deficiency and deficiency in vitamin A, vitamin D. Okay, then what else you have to remember in case of the etiology of atrophic rhinitis? In the etiology you have the bacilli. Okay, just like the Frisch bacilli I told for rhinoscleroma, this is one important Klebsiella that you have to remember. What is that? This Klebsiella ocna. Okay, Klebsiella ocna is one bacilli that you have to remember, and so this condition is also known as ocna. Okay, atrophic rhinitis is also known as ocna. Okay, so that is the infective cause behind atrophic rhinitis, and also you can have the autoimmune cause as well. Okay, now the patient will be presenting with nasal obstruction, nasal discharge, and yes, there will be a roomy nasal cavity on examination. But what is the feature? The feature of atrophic rhinitis is merciful anosmia, that is, the patient is unaware of the bad smell that is coming from his nose because of the infection. And why is he unaware? Because he is having anosmia because of the severe destruction of the nasal mucosa in the area of the olfactory region as well. Okay, so because of that the patient is unaware, but because he is unaware, it is a merciful thing, isn't it? He is unaware of the bad smell. Okay, so the clinical features of the atrophic rhinitis are, first of all, as I already told you, there will be nasal obstruction, and on examination there will be wide nasal cavity with nasal crusting. Okay, and the turbinates will have been destroyed because of the atrophic rhinitis, and patient will have merciful anosmia. Okay, merciful anosmia, that is one thing that you have to remember. Okay, and yes, how will you treat the condition? Okay, treatment of the condition involves removal of the nasal crust. Okay, for removal of the nasal crust you will have to do alkaline douche. Okay, alkaline douche. And what is used for removal of nasal crust? You will use sodium chloride, sodium bicarbonate, and sodium borate in the ratio of 2:1:1 in distilled water. Okay, and is mixed in distilled water. Then you can make alkaline douche, and with that you will ask the patient to clean his nose. Okay, you will ask the patient to stand in front of the wash basin, and that solution is poured into his nose, and all the crust will come out. Okay, this is for removal of the nasal crust. And what else can be done? You can give chemicetine solution. Okay, chemicetine solution. Now what is this chemicetine solution? Chemicetine solution contains COPD. Okay, COPD. It contains chloramphenicol, estradiol, propylene glycol, and vitamin D. Okay, chloramphenicol is used to treat the infection caused by Klebsiella oceanae. Vitamin D is to reduce the vitamin deficiency problems, and estradiol to reduce the estrogen deficiency problem. I already told estrogen deficiency can result in the condition atrophic rhinitis. Okay, so that's about chemicetine solution. And what else can be used? You can use 25% glucose in glycerin solution. Okay, 25% glucose in glycerin. And what is happening? This glucose will get converted to lactic acid, which is bacteriostatic. Okay, bacteriostatic. So that is the importance of 25% glucose in glycerin. That is another solution that is used in the treatment of atrophic rhinitis. And apart from that, what else can be used? You can do surgery, the Young's operation. Okay, Young's operation. For that, what you are doing is you are closing the nasal cavity by taking nasal mucosa from all around, and it is closed. Nowadays, modified Young's operation is done, where about 3 millimeter gap is left. Okay, 3 millimeter gap is left. These are the surgeries that are done for atrophic rhinitis. Okay, so that's all about atrophic rhinitis. Now coming to one of the questions that has been asked: true about T-cell lymphoma are associated with nasal obstruction and epistaxis? Yes, it is true. Associated with EBV. I forgot to tell you, T-cell lymphoma is associated with Epstein-Barr virus. Okay, and also it has got expression of T-cell marker. That is why it is a T-cell lymphoma. Okay, what is the marker associated? It is CD56. Okay, CD56, and also you have association of Epstein-Barr virus. Okay, and wide local excision is the treatment. What did I tell you? It is treated with chemotherapy, right? It is treated with chemotherapy and radiotherapy. Radiotherapy, if it is locally present, if there is systemic involvement, then you will have to go for chemotherapy, but never wide local excision. Okay, so this is also true, it is locally invasive. So these are the true answers. This was one question that was asked for PGI. Okay, PGI exam. And so T-cell lymphoma is important. Okay, what is the other name for T-cell lymphoma? I already told you, it used to be called as midline lethal granuloma. Okay, midline lethal granuloma, or it is also known as Stewart's granuloma. Okay, Stewart's granuloma. Okay, so today you have learned in detail about the various granulomatous conditions of nose. First of all, we learned about rhinosporidiosis, which is seen in the southern part of India, that is Kerala, Tamil Nadu. It is also seen in Sri Lanka, the other countries like Sri Lanka, Pakistan. Okay, and yes, rhinosporidiosis is one condition which is not, the etiology is not properly found yet. The organism has not been cultured. It is caused by Rhinosporidium sebrei, of course, but we are still unsure about whether it is a protozoan. It was earlier classified as a fungi, now it is classified under Mesomycetozoa, a protozoan category. Okay, that's all we know. And yes, you have to do wide local excision with cauterization, and the first surgery is the most important thing in case of rhinosporidiosis. Only if you do a proper first surgery with proper visualization of his pedicle without causing any trauma, only then you can prevent recurrence. Otherwise, there will be multiple recurrence for the patient. Okay, I have seen patients who have undergone about 92 surgeries for rhinosporidiosis because of the recurrence. Because in the olden days, how it was removed? It was removed by barbaric technique, by just looking with light. You will take hold of the rhinosporidium and then just remove it like that. Okay, the only thing will be given is a local anesthesia spray. There was no GA given. Okay, and after that a nasal pack was kept. That was the only thing that was done in the earlier days. Okay, that was the reason behind the higher recurrence rate of rhinosporidiosis. Okay, now this condition differs from the other granulomatous condition because it is presenting with just bleeding manifestation, and it will not have the typical granuloma features. Okay, it will have the strawberry appearance. It will have a typical strawberry appearance, but there won't be other granulomatous features, like it cannot cause atrophic rhinitis, unlike the other granulomatous conditions. What are the other granulomatous conditions that you learned today? You learned about rhinoscleroma, which is seen in the North India. Then you learned about the granulomatous with polyangiitis or vaginous granulomatosis, sarcoidosis. Yes, sarcoidosis is another condition that you learned about. And what else did you learn about? You also learned about T-cell lymphoma, which is the Stewart's granuloma. Okay, and also you have learned about atrophic rhinitis, which can be caused by all these granulomatous conditions. Secondary atrophic rhinitis can occur due to all these granulomatous conditions. Okay, so that's about all these granulomatous conditions of nose and atrophic rhinitis. Okay, please go and learn today itself. This is another high yielding topic from ENT. Okay, so let's see with another topic. Until then, goodbye.